Emily Weber, our Director of Nursing of the Newborn Center, is going to present to us some of the small group sessions that nursing has had on learning from defects. So this is something that physicians and NPs, RTs, we're going to start doing probably in the next 2 months, kind of like you talked about, as far as just going over what defects we think are there and then trying to bring up ideas and solutions to it so as to involve everybody in the NEO staff. So nursing originally came out with a lot of different ideas, but we're only going to present just a few real quickly today.
So I am privileged today to present the work of others. So Amy Clark is actually in an advanced quality improvement class right now, so was not able to join with us, but did want to present some of the work that she's done with the nursing staff already to look at defects. So what she did was she pulled together 10 to 20 nurses on the day shift. So she started in small groups. She did include nurses on each of the different units, and they really focused on defects. So quick things, how can we reduce the risk for the next patient, some events that they've already been involved in, and also really challenge them to brainstorm with some solutions. So they came up with several. It wasn't hard to do, but here are 3 that I think are really important and kind of spurred some action that will really benefit patients not only in the newborn center but outside as well. So one was there was not access to interosseous needles immediately, and so when you do need those in a code situation, you need them very quickly. And so a nurse had been involved in a situation where they really had to scramble to get that supplies. So that's formed up and went to the CPR committee so that we can add it not only to the NEO crash carts but house-wide so that we're able to have them immediately. Another nurse was involved with a trach situation, and when she was going to the ties to untie, it was in a jumbled knot. So we don't really have a consistent and standard way of doing that. So channeled that to the unit practice council so that we're able to come up with a consistent way so that it's safer for the next patient. And then PIV infiltrate. So there is a way for the Alaris pump to be set for pressures. However, because the pumps that we have rotate to the pediatric side as well, if you had an IV infiltrate, it doesn't, for our small population, it doesn't pick that up because the pressure that their experience is set at like a 15-year-old. So the manufacturers have been contacted already, as well as Biomed is looking at how they program our pumps, and is there a way that through the neonatal setting that we can change it for our patient population to make it safer. So there was a variety of different defects that were identified, and these are really outstanding ones that we're able to make impact and make it safer for future patients. And so I challenged Amy, okay, we need to do this on night shifts, on weekends, involve others, physicians, respiratory therapists, parents, make it safe. And I took notes during Brian's presentation, and part of his words of advice were to take it slow and make it rewarding. And that really increases the resilience. So making sure that, we identify the defects, we close them out, we celebrate them, and then move on to more. So we will be contacting and involving more, but we want to make sure that, we're successful in our approach. I do think this is a powerful tool, though. We have events and situations that happen in the newborn center and the hospital all of the time. And so you're able to do this after an event that happens, pull together your peers and talk about what went well, what didn't go well, and what can we do to make it safer for your patients in the future. So I encourage and empower you to do that. And in Brian's words again, remember, especially even for just today, not to worry, but to be open to the ideas, and to encourage others to do so as well. So thank you very much.